for all seniors. Thank you.
Yeah. Thank you, Ron. Thank you, Alice. We're here today to celebrate Medicare's 47th anniversary, but we're also here because the future of Medicare is under attack. Medicare was created as part of the Social Security Act of 1965, which was signed into law by President Lyndon Johnson on July 30th, 47 years ago today. It covers health care expenses for 48 million elderly and disabled Americans nationally, and over 100,000 people right here in the 7th Congressional District. Talk to any senior, and they'll tell you what a great program Medicare is. Ask anyone in their 50s or 60s about the program, and they'll tell you how important it is to know that your medical benefits and your medical coverage will be secure when you retire and in your old age. Now, in 2010, just 2 years ago, while he was running for election, Congressman Pat Meehan declared that he would not vote for the radical Republican agenda to replace Medicare with a privatized voucher program. He made that promise. But since being sworn into office, he has voted in 2011 and again this year in 2012 to do just that. The Paul Ryan budget passed by Congressman Meehan and House Republicans makes radical changes to the existing Medicare program, and it fundamentally ends the program as we know it. Medicare provides essential guaranteed benefits for all who qualify and enroll, the right to basic health coverage, including coverage for doctor and hospital visits, stays in skilled nursing facilities, home health care, and other health care needs. Congressman Meehan's proposal, the one he voted for twice, would mean a dramatic hike in U.S. health care costs for the elderly, and this has been confirmed by independent analysis. Seniors would pay, at the beginning, over $6,000 more each year for their health care, and that number would go up as time goes on. Nearly 4 million seniors would be forced to pay an additional $2.2 billion in prescription drug costs for next year alone. The budget that Congressman Meehan and the radical Tea Party Republicans voted for goes not just for those at retirement. It eliminates guaranteed benefits completely for people that are under age 54 or younger. It replaces the guarantee of coverage with a federal contribution of diminishing value that the individual can use to purchase health insurance when they get older. This change will affect 490,000 people in this congressional district alone. That's 74% of the district's population will be affected by this change. Starting in 2022, all new enrollees in Medicare would be forced to buy private insurance using an underfunded federal contribution, a privatized voucher, with no guarantee that they will receive the health care benefits that they need. As we all approach 65, and hopefully all of us will get there someday, if we're not there already, we rely on the security that comes with knowing that you'll have medical coverage in your retirement. Congressman Meehan should be ashamed to have voted to gut the program and replace it with a privatized voucher program. On top of all that, Congressman Meehan broke his word. Meehan broke his promise on Medicare. When he was running for office 2 years ago, he looked us in the eye, he was on television, and he said he would not support that radical Republican agenda. Since then, he's voted for it twice. This is the first time he's up for re-election this year. And if he were to win, and if we were to have a Republican in the White House, he would be able to get this plan signed into law, and Medicare, as we know it, would be gone. This is not a hollow publicity show, but a concerted effort to end Medicare as we know it. The 47th anniversary of the program, the 7 district voters have a fundamental choice. Given the opportunity, I will focus my efforts on rebuilding our economy, not attacking this great program. We need a member of Congress that is laser focused on supporting middle-class families. We need a member of Congress fighting to strengthen Medicare, not to end it. I'd like to thank everyone for coming today, and I'd be happy to answer any questions.